9:20 now. Earlier this week, the government announced its cancer plan for England. A 10-year strategy promising earlier cancer diagnosis and faster treatment.
For the first time, the national plan contained a section focused specifically on children and young people, something welcomed by campaigners and charities.
Our reporter James Ingham went to meet a mother who lobbied tirelessly for reforms after her daughter died from a rare cancer, aged 10.
Sophie was, in her mum Charlotte's words, a happy, positive, energetic and beautiful girl. After being diagnosed with a rare cancer, she endured months of gruelling treatment. But nothing could keep her alive, and she died surrounded by her family at just 10 years old. Since then, Charlotte's worked tirelessly to try to improve the chances of others like her.
Children like Sophie deserve better treatment. They deserve a right to live. And 1 in 5 children with cancer will die. And that still is too high a number. But those 4 that survive, although they survive, they are often left with lifelong issues as a result of their treatment.
Charlotte teamed up with other parents, travelling to London numerous times to meet experts and politicians with support from her MP. Caroline Dinenage led a task force which has resulted in the government's national cancer plan, specifically including children and young people, for the first time.
Absolutely horrified that Sophie's story tended to be the norm rather than the exception, a story of late diagnosis, many missed opportunities to diagnose her cancer early, eventually being diagnosed in an acute hospital setting, by which time her cancer had reached a really late stage.
The plan outlines a number of pledges, which include making research into children and young people's cancer a priority for the next 3 years, speeding up the detection and diagnosis of cancer. And when children and young people are being cared for in hospital, families will get help with travel costs, improved food, better play provision, and more psychological help.
I'm so pleased we have finally managed to get this published after 4.5 years of campaigning. There's an element of sadness as well, really, that this doesn't bring Sophie back. But what it does do is make sure that it actually impacts other people, and we couldn't save Sophie, but we can now go on to save others. And what incredible legacy. I stood up at her funeral and I said this will be Sophie's legacy, and it is.
James Ingham reporting there. We can talk now on this with paediatric oncologist Professor Bob Phillips. Hello.
Hello there.
You know Sophie's mum?
I do.
Wow.
Yep, Charlotte was part of the Cancer and Young People's Task Force that put together to us this cancer plan, along with a whole bunch of other experts and cancer charities to push this forwards.
One of the things that were brought to the table there, we saw, was the care and keeping a child occupied, keeping a child with their mind off cancer, not to just feel I'm just here because of cancer, but I'm also going to be a child. But the other thing that it brings to mind is that young people don't get cancer. That's the narrative, isn't it?
Isn't it? You think cancer doesn't happen to young people, and yet, on average, 4 families a day find that their child or young person has got a diagnosis of cancer within the UK. That's not rare, is it?
And so, if it's not rare, why are there still, reports or experiences of growing pains?
Yeah.
You'll grow out of this. No, you don't give a child a full MRI scan. No, this isn't necessary.
It's a complex situation, because the same things that kids get when they present with cancers are the things that they get with illnesses that will just go away on their own. And so, as a national community, we've been working to put together the absolutely best information for parents, but also for frontline doctors, GPs, A&E doctors, in something called Child Cancer Smart. And that's the Children and Young People's Cancer Association that's drawn this together and got money to pay for really good quality research behind it.
How will you know, Professor, whether these changes, these improvements, the money, how will you judge whether it's making a difference?
Well, what we really need for that is for the data that is routinely collected on when someone first goes to the doctors versus when they get actually diagnosed. We need to see that getting shorter. And in order to do that, we need the various bits of the NHS to collect that data together and make it available so that we can actually say, this year it was 15, next year it's going to be 14, next year it's going to be 13, and we see these gaps getting shorter and shorter and shorter. And that's part of the plan as well, to really improve what we do with the data that we've got, we just can't use.
Can you give us an example of a time when it hasn't worked the way it should? Because you must have seen lots of incidents over the years of diagnoses not being diagnosed the right. Can you sort of give us a sample of when it hasn't worked the way you would want it to?
Many. So one of the best examples is bone tumours in young people. And they often present in sporty young people who have an injury. And the injury just goes on, and it's 2, it's 3, it's 4 weeks, it's longer than expected. And they go to the physio and they have an ultrasound, and then eventually somebody does an X-ray that shows an abnormality. That then leads to an MRI scan. Then they get sent to one of the specialist centres, and finally the diagnosis is underway. And with better understanding of this, that if there are more than 3 symptoms going on for more than 3 weeks, unusual patterns, we should be thinking serious diagnosis a lot more quickly.
Can I ask, it's a very naive question, born of ignorance. When cancer in children isn't diagnosed, is there a difference in terms of how the stages can increase compared to adults?
Yeah.
Is there more of a risk of kind of it going from stage 1 to, say, stage 3 or 4 quicker? I don't know if that's a stupid question.
No, it's not a stupid question at all. And it's really difficult to answer because cancer is actually not a single thing. It's a whole load of different diagnoses.
Itself, isn't it?
Yeah.
As well? And obviously children, when they're growing, this is why I ask, things are changing so often
And what we definitely know is that if we can diagnose quicker and we can treat quicker, we can certainly get to the point where we may need to use less treatment. And that means that we can get good outcomes with fewer side effects, the sorts of side effects that last for 50, 60, 70 years of a kid being alive afterwards. We might also improve survival rates as well, but we'll definitely be able to drop the amount of treatment and the short and long-term side effects of that treatment.
I just wonder, so the report we saw a moment ago, and you say you know Charlotte, that final picture was of Sophie, just 10 years old. Such a beautiful young girl who died.
Yeah.
You must be full of respect for families who've been through that, like Charlotte, who have then turned to try and make sure that someone else does not. Their family story is not that one.
Absolutely massive respect. There are so many people like Charlotte, like Vicky, Liz Hatton's mum, who are pushing forward the stories of their young people in order to get children's cancer, young people's cancer, aware, get better research, get things moved a lot more slickly than they could do. And that will then lead, in this 10-year plan, for us to really make a difference and make much better outcomes for everybody.
Really interesting talking to you. Thank you so much for your time on a Saturday morning as well.
Thank you for asking us.
Thank you very much,
Thank you.
Professor Bob Phillips, paediatric oncologist. Thank you.